My name is Dr. Marissa Blake, and I want you to settle into this conversation the way people once settled into long evenings, without clocks, without urgency, without distraction. This is not something to rush. This is the kind of talk that unfolds slowly, because the subject itself has been working slowly inside you for decades. I am speaking to you as someone over 60, or someone who loves someone over 60, because there are truths about the body, especially the heart, that only become important when time has already passed. I have spent much of my life listening to people tell me they waited too long, not because they were careless, not because they were irresponsible, but because they misunderstood what aging is supposed to feel like. They believed that slowing down meant suffering, that discomfort was the cost of survival, and that the body after 60 was something to tolerate rather than understand. The heart is central to this misunderstanding. It is faithful beyond reason. It adapts silently. It compensates patiently. When arteries stiffen, it pushes harder. When oxygen delivery becomes less efficient, it beats faster. When pressure rises, it thickens its muscle. The heart does not complain. It adjusts. And because of that, many people assume everything is fine until it isn't. As you age, changes occur that are neither dramatic nor sudden. The heart muscle may become slightly less flexible. The chambers may not fill as efficiently between beats. Blood vessels, once elastic, gradually stiffen. These changes are natural. They do not mean disease, but they do mean that the heart now operates closer to its limits. What it once handled effortlessly now requires cooperation from the rest of the body. This is where misunderstanding becomes dangerous. Fatigue is dismissed as age. Breathlessness is blamed on inactivity. Swelling in the legs is ignored because it goes away overnight. Chest discomfort is explained away as indigestion or stress. Each of these may seem minor in isolation. Together they form a language the heart uses when it is under strain. High blood pressure is perhaps the most deceptive force affecting people over 60. It often causes no pain, no obvious warning. Yet day after day, year after year, elevated pressure damages the inner lining of blood vessels. The heart must push against this resistance constantly. Over time, it thickens to cope. Eventually, this thickening reduces efficiency, and the heart begins to tire. Many people discover they have had high blood pressure for years, only after damage has already occurred. Cholesterol behaves in a similar way. It does not announce its presence. Plaque forms slowly along artery walls, narrowing the passage through which blood flows. The heart compensates by increasing force. At rest, everything may feel normal, but during exertion or stress, blood flow may no longer meet demand. The first warning is often fatigue or breathlessness, not pain. This is why so many heart conditions are mistaken for aging rather than recognized as treatable problems. Blood sugar adds another invisible burden. Elevated glucose stiffens blood vessels, damages nerves, and interferes with circulation. Even mild, long-term elevation increases cardiovascular risk. When diabetes or prediabetes develops later in life, it accelerates processes already underway. Managing blood sugar after 60 is not simply about avoiding complications. It is about preserving the heart's ability to function with dignity. Movement plays a vital role, but it must be reframed. The aging heart does not respond well to extremes. It responds to rhythm. Gentle, consistent activity tells blood vessels to remain responsive. It trains the heart to pump efficiently rather than forcefully. Walking, light strength work, balance exercises, and controlled breathing are not lesser forms of exercise. They are precisely what the older cardiovascular system needs. Many people stop moving because they are afraid of falling, afraid of pain, afraid of doing something wrong. But stillness carries its own risk. Without movement, circulation slows, muscles weaken, blood pressure rises. The heart must work harder to do less. Safe, regular movement is not about performance. It is about preservation. Food becomes a powerful signal after 60. The body no longer tolerates excess quietly. Too much salt increases fluid retention and pressure. Too much sugar fuels inflammation. Highly processed foods demand more work from digestion and circulation. Meanwhile, whole foods, vegetables, fruits, legumes, whole grains, nuts, healthy fats, reduce strain on the heart. Eating well later in life is not about strict rules. It is about easing the heart's workload. Sleep deserves far more respect than it usually receives. During deep sleep, blood pressure drops, heart rate slows, and repair processes activate. When sleep is poor, the heart never fully rests. Chronic sleep deprivation raises stress hormones, disrupts metabolism, and increases inflammation. Many people over 60 accept poor sleep as inevitable, not realizing how profoundly it affects cardiovascular health. Emotional health cannot be separated from the heart. Loneliness, grief, unresolved stress, these are not abstract experiences. They alter hormone levels, tighten blood vessels, and increase heart rate. The heart responds to emotional pain as surely as it responds to physical exertion. After 60, protecting emotional well-being is a form of cardiac care. One of the most important lessons I try to teach is how to listen. The heart rarely fails suddenly without warning. It whispers first. Reduced stamina, longer recovery times, subtle breathlessness, changes in sleep. Paying attention to these signs allows intervention early when outcomes are better and options are broader. Medical care should be seen as partnership, not surrender. Regular checkups provide insight into how well the heart is coping. Monitoring blood pressure, cholesterol, heart rhythm, and blood sugar is not about fear. It is about foresight. Medications, when needed, are tools that reduce strain, prevent damage, and extend quality of life. They are not replacements for healthy habits, but they are valuable allies. I have watched people reclaim years of comfort simply by making small, consistent changes. I have also watched people suffer needlessly because they waited for pain that never came until it was too late. The difference is rarely knowledge. It is timing. Aging does not mean giving up strength. It means redefining it. Strength after 60 is not speed or endurance. It is stability, awareness, and resilience. It is the ability to live without constant discomfort, to move without fear, to breathe without effort. Your heart has worked for you every moment of your life. It has responded to stress, joy, loss, and labor without complaint. It has adapted in silence. Now it deserves attention in return. Not panic, not obsession, just respect. Slow down when needed. Move when able. Eat with intention. Rest without guilt. Speak up when something feels different. These are not dramatic acts. They are steady ones. And steady care is what the aging heart understands best. I am Dr. Marissa Blake. And this counsel comes not from urgency, but from years of watching what happens when people finally listen to their hearts, and from knowing how much life can still be lived when they do.